there is a connection between obesity and diabetes. There are some data that suggest that food insecurity is connected with several patterns of eating. And that is the people that are facing issues with food, they in many cases are going to use some of the programs that are connected with the food system, for instance, WIC or SNAP. Now Mexico, they have one of the highest levels of obesity. It's like for women, diabetes is the first cause of that in Mexico. That there is no any difference now in terms of the characteristic of the fast food that you're gonna find in Mexico and the United States. I don't know, the border, you're gonna find obviously all these issues with food deserts and level of the level of poverty tend to be higher in the border. And there is also a shortage of grocery stores, but also a shortage of any kind of services that physicians and pharmacies, so the border tend to lack of this kind of services. Obesity is disconnected not only with the lack of medical care, that could be also the lack of information. You're going to find also this kind of communities, poor community, they don't have access to a regular medical care because they don't have medical insurance. That you assess the ratio of physicians in poor communities tends to be very low. Again, these communities are facing a lot of problems with barriers for transportations to be able to arrive to this area, but it's also associated with people. They are working for a long period of time, and then when they arrive home, there is obviously they are going to be surrounded. They don't have access to grocery store, but they are surrounded for something that some scholars call the toxic environment. And with this community, you are going to find that the ratio of fast food restaurants is to be very high for them. There are some genetic components there, but the most important that we are able to prevent is the environmental factors. That if we change diet, if we are able to go back to something that was connected with changing our patterns of the food that we are eating, that's going to have an important impact in terms of reducing the incidence of diabetes in the population. In terms of what is like the best way to eat in terms of the quality of the food, in many cases, these people that are living in this, they are receiving for instance, a food stamp. They don't have access to quality of food, a healthy food.
We're all adapting to this really cheap way of eating, which is, I don't have to grind my wheat, I don't even have to grow it. I just have to go to the grocery store and buy a bag of white flour. There's a long history of people eating poorly. Eating poorly creates great conditions to develop diabetes.